So in the clinic, we have a suite of equipment that we use that are from valves. We have our force plates, we have our force frame, and we also have our dynamo. And I think in understanding where each one fits in the rehab pathway is quite important. So if we have somebody comes in that has a very acute injury, we're going to use our dynamo to be able to assess the individual muscles and the individual joints to see how strong they are and compare right to left. That will be able to give us a metric that we need to be able to work on. So we'll use this very often for our shoulder patients who are post-surgery shoulders or post-injury shoulders. Then what we'll do is we have the bigger muscle groups, we'll start to use our force frame. Because our lower limb muscles produce an awful lot more force, we need something that's be able to be a little bit more stable to give us more accurate data. Three really good pieces of equipment used at the correct stage of the injury process helps us give us measurements and data that we're able to use to design the rehab program for each one of our patients, whether that's a general population patient or it's going to be an athletic patient trying to get back on the pitch and trying to rebuild that confidence post-injury. This is probably one of our main pieces of kit that we use in the clinic, and these are what we call force plates. The force plates are generally used to analyze how people jump and how people land. The importance of analyzing how people jump and land gives us a metric of how well that body is able to, number one, produce force, but also, more importantly, how they're able to absorb force. The biggest thing that we take out of using force plates is the asymmetries between right and left. And coming back from injury, it's really important to understand how that limb is functioning as one unit and how it's also functioning compared to the non-injured limb. This will throw out a report that will be able to show, right, you have a 20% deficit between your right side and between your left side, and then that gives us an area to treat with some targeted exercises to try and improve that metric. But it's a really useful piece of kit to give us the numbers that we need to work with, but also show you the asymmetries between right and left side.